Hello, everyone. My name is Lonnie McQuilkin. I am a first-year MPH student at the Dornsife School of Public Health in Philadelphia. I also help with the reporting for the Pennsylvania Medical Home Program, which is at the PA chapter of the American Academy of Pediatrics. We'll be discussing adolescents, well-care visits, and immunizations. Can QI move the needle? So adolescent well-care visits and vaccinations are part of the Bright Futures recommendations for preventative pediatric care, yet practices do experience gaps in providing these services at times. The PA Medical Home Program is a network of primary care practices. There are 198 in the state, situated in urban, suburban, and rural settings. The medical home is an innovative way to approach pediatric care by providing more wraparound services for patients and their families. The PA MHP conducted a quality improvement project that was also eligible for maintenance of certification Part 4 credit for practitioners, which is a more in-depth experience to maintain certification, in order to increase the rates of adolescent well-care visits and vaccinations, specifically HPV, Tdap, and meningococcal immunizations. The objective of this project was to describe successes, challenges, and outcomes of a QI project among a network of pediatric practices addressing adolescent well-care visits and immunization rates. Participants included a subsample of 13 PA MHP practices, which consisted of 76 practice team members, 32 of whom were practitioners. From January 2018 to January 2019, the PA MHP team conducted 6 continuing medical education and continuing education credit webinars, an in-person QI bootcamp conference, monthly practice QI calls, and ongoing technical assistance when needed for the participating practices. Key driver programs: plan, do, study, act cycles, run charts, descriptive statistics, and the quality improvement data aggregator KEDA were used to accomplish this project and collect data. Data was pulled in 3 cycles in May, June, and August of 2018. Here with this first chart, we can see that well-care visit rates did increase from cycle 1 to cycle 3 among males and females. And as far as immunizations given by 13th birthday, all 3 immunizations were improved from cycle 1 to cycle 2. However, HPV rates did decline from cycle 2 to cycle 3. The initial increase in well-care visit and immunization rates could have been due to practices addressing this initiative in a more intentional way than was done previously. Vaccine rates could have been influenced by the way practitioners were discussing immunizations with families. For example, with the HPV vaccine, whether a practitioner marketed it as something that can prevent cancer versus something that the child did not need until their 13th birthday, the parent would opt in or out, maybe based on how urgent it seemed to get the vaccine. Another impact for these immunization rates could have been the time that this data was collected, as well as the well-care visit rates. It's harder generally to get pediatric patients in for this care in the summer months. Successful strategies that were shared and adopted by project participants included changing practice culture and team education. This could be team huddles or reports, reviewing opportunities to immunize at every visit, amongst maybe siblings, having standing orders reviewed, and then reviewing immunizations early. Also, turning sick visits into well-care visits when appropriate, exercising motivational interviewing techniques, and leveraging existing resources for education and communication, such as social media, flyers, telephone calls, or appointment reminders. This multi-site QI project increased adolescent well visits and improved immunization rates for 2 of the 3 key adolescent vaccines. The integral role of a learning community in a primary care practice network with diverse geography, practice demographics, and patients, ongoing technical assistance, and goal setting holds promise and value for future quality improvement work and projects. And of course, we want to acknowledge and thank all of the willing practices and families who participated in this QI project that will help drive future QI initiatives.